nice.
Yes, yes.
Thank you for coming. You were there last night. No.
No.
Okay. We just had a little get together and met everybody for a little bit and talked about stuff. Today, I thought since it's a smaller group, I don't know, I could stand up there and present, but I get nervous with stuff too. This one might be good, and then a smaller group's nice too. So we have truth be told why rabbit teeth never get a day off. Can you all hear me if I'm faced the other way? I don't know, because I have my back to you too. But so we're gonna do our agenda today. This is for a large audience, so it's all. Wait, okay. We'll unredact that and show you what we're actually doing. So introduction, anatomy, maintenance, abscesses, and some case studies. I can promise
I can spin the computer around if you'd like to sit on the other side of the table.
I can promise you there's gonna be some gross pictures, but I think you have seen some stuff. It sounds like you've seen some bad stuff. And then we're gonna have one boring slide. I can't get out of it. And it was taking forever to zhuzh it up, so I thought I'm just gonna leave this one boring and explain it, and you'll understand too. So why are we here? Is this gonna be in? Okay. Rabbits kept indoors, fed cereal-based high-energy food mixed with hay and veggies are high risk. Outdoor pets rarely suffer from malocclusion, so rabbits running around don't get what indoor rabbits get. And then oddly enough, lab rabbits, they're usually fed like a liquid diet, have no malocclusion, so they're just in a laboratory and they don't have this problem too. So tooth growth is affected by many factors. Hello, come on in. We're just getting started. Why am I here? I'm Dr. Linda Kitchen. Thanks. I own Animal Hospital of Bonita, and I graduated from Ross University in 2008. Owner of Animal Hospital of Bonita since 2015. This is our staff. We won Best Bonita 24-25. And there you can see Dr. Anderson too. I used her picture. She's back here. She's going to be speaking at 2:30.
Yes.
Okay.
I'm see you around.
So how many teeth do they have? If Eleanor, my dog, was here, she'd be able to do all these numbers. 28 teeth. 6 on the upper and the lower. So 6 in the front incisors, 12 upper, 6 on one side, 6 on the other, 10 lower. To compare that to dogs and cats, 42, 30, and humans are 32. So they have way less teeth than we have. This picture I thought was amazing because you don't usually, like, no one thinks that that's what the inside of the rabbit's mouth looks like. So for some anatomy, the mandible is more narrow than the maxilla, so the upper and then the lower is set in there. So when they're chewing, only one row is connecting at a time. So they have a like a cross motion, but they'll do some forward back, but it usually is a bit more cross. But then when they're moving like that, only one side touches and then the other side touches. So if they have a mouthful of teeth or a mouthful of food, half of their food is not being chewed at the same time. Chewing about 120 times per minute. Inside cheek is lined with fur named fur tufts or cheek fur that's in there. And so when you're trying to get in there, you're just like, what's all this? But they thought that was when they're out there chewing up stuff and they get a nettle, the hair will collect that and then it won't go down and cut their throats. Hi, come on in. There's something called the diastema, which anybody who's had to force feed a rabbit before knows that space. And that is the space between the incisors and the molars are much bigger. So if you're instructing people on how to force feed them, they're typically only doing it in the front. And come on in. Doing it in the front, and they're not.
It's her fault. We're late. She do not belong to me.
Come on in, have a seat. So they're just putting it in the front of their mouth, and you have to go further back. And people are afraid that they're choking them, but they're. Really, the rabbit just spits it out.
Hi. We just made an announcement, so we might have some more takers.
Okay. Thank you for coming. Thank you. So that part is great for force feeding. Some other important facts: the teeth grow about 2 millimeters per week. The incisors are faster; they're continuous. Teeth grow usually resting or sleeping at night, and the cheek teeth need stimulus to grow. I have another slide that'll put that into home a little bit more, because oftentimes we have problems with the incisors. Think of that separately as problems with the molars and the premolars. The mandibular lower teeth grow faster than the upper teeth, and then the mandible has thinner enamel. So and the enamel is stronger on the tongue surfaces, so it makes a chisel. When they're wearing those down, it'll wear down like this so the inside towards the tongue is a little bit stronger. We don't have an exact reason why that is. Like, they have a little bit more acid in the saliva. Is it to protect that? But what it helps is the rabbit has a chisel in there that it can mow down its food a little bit more efficiently. You look at the teeth, not all molars are created equal. You think, oh, there's 6 up there, and they're just like little blocks up there. But 1, they're chisels. 2, you look at these little guys in the back, think of them as like little bookends. And you can see this on this diagram. Those little guys, like M3, what's that doing there? It's just keeping the other ones in, and those middle ones are the ones probably doing all the work. Talking again, just the molars. So those little guys in the back, they're just kind of, they're holding up. More of the molars are doing discrete growth. They're not just like continuously growing in the back, but the incisors are doing a lot of cutting. So they're doing a lot more work. They need to be growing constantly, but they found the molars just aren't. They're like in stages. Abnormal enamel. You can have diet causing it. The metabolism could be off. And that's regulated by the parathyroid and the thyroid at the neck, calcitonin hormone, vitamin D, calcium, and phosphorus in the diet, which is why that's important to know that the ratio of calcium to phosphorus we'll get into. Fluoride in the water from Bonita, they just had the fluoride taken out of the city water. A lot of people, though, are on spring water, on filtered water. I know we've talked a lot about what type of water, and sometimes depends on what's in the water, but if it's just regular, just water, then you should be fine. Antibiotics will have some effect on what the teeth are, color and consistency. And then if they ever run a fever in their life, if they have systemic infections or chronic diseases, that has some effect on how the teeth are. This rabbit came in, it actually has both of these. So the first one, hypocalcification, normal thickness, but it's not mineralized. And those lower teeth there, you can see they have a chalky, like a glass-like appearance at the points, and that's when you know the calcium isn't there, like not enough calcium, versus hypoplastic, which is change in formation, which is that upper, on this picture, the tooth on that side, but it's looking at you, so it's the left, but that little wave line, that's change in formation, can be limited to just one tooth. Or and if it's just one tooth, you look for infection or trauma just for that one. Other things that could happen, they're grooming a little bit. This one had hair shoved up under the gum line too that you can see at the top. Thicker, harder foods such as grains and pellets have more vertical force on the grinding, leading to dental spurs. So if we're on grains and pellets, you're possibly going to see more spikes in the teeth. Hay is always the best, and Jen and I have talked, like the one I'd say that lived the longest that I've been in contact with was Cowboy, and he only ate greens, or only ate hay. Like, he wouldn't touch anything else, and he lived forever and had very little dental issues. I've none.
His teeth were white right till the day he was almost 14.
Wow.
Yeah, he had some beautiful teeth.
I'm sorry, the back door isn't unlocked.
So also in their incisors, rabbits typically do not gnaw like rats. If you have someone gnawing, look at their teeth, look for anything, including the front or the back, and look for behavioral issues, because that's something else that they're doing. We had one that came into board for Irma, I think, and that little guy chewed a hole in my baseboards in room 4 if you're in there, and it's because he was there boarding and he hated it. And there was nothing wrong with his mouth. So that one was more behavioral issues. They don't use incisors for grasping. You think like they grab it, and they're not playing tug of war with their incisors. Those teeth aren't made for that purpose. And if we have to remove the incisors, you think this rabbit's going to starve. They do great. What you can do if you have a rabbit with no incisors, though, just cut their hay up into further pieces so they can use their lips and they push it back and then grind it up with their molars. In summary, best is like hay all the time, constantly. The other stuff treats very little of that. And you have to try to mimic the growth rate equals the abrasion rate, and then you won't have as many problems. So by the numbers, this isn't the boring slide. There's one that's more boring than this. But this is the percentages of what you want. And a lot of this stuff you can look online for different percentages. And there's other people here that are going to tell you a lot about what is in their feed versus others. But what you're looking for calcium to phosphorus ratio, 1.5 to 2 parts calcium per 1 part phosphorus. And that'll keep teeth solid. That'll keep you from having, for most rabbits, having no bladder sludge. We have those outliers like these, and then we'll have one example of this one rabbit. We absolutely took everything away from that rabbit except for Timothy hay, and he was still producing sludge, and we were like, what is going on with this kid? But too little protein, you'll notice the rabbit is unhealthy, like the coat is kind of dry, brittle, the nails aren't as strong as they could, they break off. Too much protein, you're putting all that protein through their kidneys, and then you're going to go into kidney failure eventually because you're just exercising those kidneys all the time. But something before that, you'll notice like smelly urine, and as we know, they don't get UTIs very much. Like we really don't see UTIs much in rabbits, which is crazy because of the anatomy so close, but they don't have that same issue there. So certain veggies are better than others. Not all are created equal. This for our overweight buns here, we have them. You want 1 cup of leafy greens for about 2 pounds of ideal body weight. You're looking for ideal body weight and going from that, and then 1/4 cup of pellets per 5 pounds of rabbit per day. Certain ones of that side you use moderately. We all know about kale being a high calcium, but there's a few others that go really high too. And then all the good ones, romaine lettuce, celery, green leaf lettuce, bok choy, are considered balance of that 2-to-1 ratio of calcium to phosphorus. Unlimited healthy hay all the time. I put this slide in because I don't know how many people are using papaya root chews. Have you seen that? Maybe there'll be some down here, but I was like, what is this? But papaya root, it's like the root of the papaya tree. They're able to chew on that, and of course they say they love it, but has anyone seen any? They're huge. And
are they good or bad?
Good for the rabbits, like good to chew down.
Growing in Miami everywhere.
Yeah, it might.
Dig them up and
I mean, of course you're gonna destroy the tree when you do that, but maybe if you have one that's ready to go, or something. They sell these online though. if anybody wants to try one and report back to me if that's a good one.
I've tried them. My 3 buddies don't like them at all. They won't eat them.
Do they look like that, where they're a hollow and like a looks like a loofah sponge?
the bamboo plates are really good.
If you have a bunny and you're not sure what's going on, if you look at the teeth, you'll see if they're grinding their teeth, if they're anxious, if they're like mentally something's up, you'll see the enamel's polished down. If they're abrading the teeth, like you'll see a bunch of scratches on it. So it matters how they're chewing and what they're chewing on, and then that'll give you some clue. Is it a tooth issue or is it a behavioral issue for this one? Some of the things that we see incisors for, like various types of just malocclusions there, and there's a different way to correct each of these, and in some cases you're pulling the incisors if they can't correct it. Like the first one up there, I would say try to go for a correction first and then see what you can do. Those 2 bottom ones, there's growth plates in the mandible when they're born, and then growth plates up here close down at different times in the life of the rabbit, and sometimes it's like a pug or brachiocephalic, bulldog, where the teeth are in front. You don't necessarily want that, but that's just how they're born. See, that's what you have to deal with when you have met your match and that rabbit's yours for life, and then you might have something like this to have to deal with. But they don't snore, so it's better than an English bulldog, I would say. When you're looking, you see that first one is the incisors aren't right here. The cheek teeth are apart. They should meet, but they shouldn't be ground together. but there's a slight opening at the top there. So, but then incisors are the ones that are causing that. Either the incisors are too long, or they're not formed right, they're not meeting up, so the back teeth are open. And then on the lower one, the cheek teeth are occluded, meaning there's an issue there. So the incisors, you'll see a little gap. Typically, you'll see a little gap, like they'll rest. They'll just rest, but they're not like where you're looking. You're like, oh, that looks like it'd be uncomfortable. Except for in all this, whenever I see people, I'm like, go with your gut. Like, you think something's wrong, something's wrong. You know, you're at home, you're with these bunnies all the time. You know something's wrong, and if you go to the vet and you're like, I know something's wrong, and if they don't listen to you, wait, find another vet or a second opinion. And none of us care. Like, we don't. I'm okay with a second opinion. I'm okay if you go get a second opinion on my opinion. You know, and then there's something like, this could be what this mouth looks like now, but what does it look like in 2 months? Looks possibly completely different if you change the diet, or circumstances change, or, you know, they start chewing on something else. So University of Bristol in 2022 came up with a Bristol Rabbit Pain Scale. This is breakthrough because rabbits hide everything when they're sick, and we didn't know. So they analyzed everything, came up with a 0 to 18 pain scale, and instructed vets, if it's at 5.5, that's when you start pain medicine. This is what it looks like. So I recommend, like, look that up, print it off, give it to people when they're like, I don't know if my rabbit's upset or not. So they looked at 6 different categories. They have instructions there. Observe the rabbit for 3 minutes and then approach the cage, and try to catch these of what they're doing. For their demeanor, locomotion, posture, where their ears are sitting, what their eyes are doing, and how they're grooming themselves. Because if they're not grooming, then something's up and you get a 3 there too. This one's really awesome that they started doing this. Of course, England, there's more out there. So at home, touch the rabbit. Touch the face, eyes, jaw, look for saliva, look at the nostrils, look at eye discharge, eye protrusion, third eyelid, how chewing, if he's smiling. Rabbits have 1 puncta per eye, so there's 1 tube. We say this all the time. When you cry, your nose runs too, and that's because you have this tube that meets from the eye down into the nose. If they're tearing up, that should be somewhat coming out the nose, but then it gets dehydrated there. But if you're seeing eye discharge, the puncta's there. You think it's a puncta, but I see a lot of second opinions on eye infection with the puncta, and I'll show you in a minute why that's not 100% just an eye infection like that. Could be an eye infection, but we'll have some thoughts on something, you know, there's another underlying cause. When you go to your vet, give an accurate history. We always talk to each other in signalments. So we're like, how old is he or she? What's the breed? As you know, a lot of that matters for teeth there. And history, I didn't have that written here. Previous dental history. There's a lot of you know about a certain thing that happened, barn bunnies that were in the area, and I've heard there's like 48 barn bunnies out there. So if someone tells me that's one of these, then I'm like, oh, I know where you guys came from. I know where you were before. But any medications they're on, any weight changes, behavior, then of course a lot of times they're coming in for GI stasis too. And there's always a cause underlying for GI stasis, and we're looking for a dental issue of that, of course. Even with most meticulous external exams done by you and done by the vet at home, only 20% of the changes can be found examining. So how do we find that other 80%? How do we know these guys are sick? X-rays. This is one of my favorite books, Dentistry in Rabbits and Rodents, and they instruct there in that book how to examine, because you'll take an x-ray and you're like, okay, I got this x-ray. Is it, one, has to be in the best position that you can. And then you start to measure that yellow line goes from the occipital. There's something called the bulla, which is those circles back there. And that's the inner ear. And you go to the end of the hard palate. And this rabbit by the book is normal. But if you look at like right here, you're like, well, these teeth are sticking out. So does that mean those are too long? Not necessarily. And then is this a wave? No. They're supposed to have a little saw to them because that's how they break down their food, but that's not necessarily a problem. We'll see some more right now. So this one, you could see on x-ray this was a problem. Then this might present like this in real life, something like that. Now this one you'll see that first tooth on the, is that on the right side, plus the skin behind it. We'll go through some case studies here in a minute as well. So then how much do you trim? Because there's like people bring these rabbits to the vet and they're like, we need to trim these down. And I don't want to come back in another 6 months, or this wants to be the last trim in the world, you know, and I'm not going to spend money on this. For guinea pigs, chinchillas, you can trim up to the gum line, but in rabbits, you don't necessarily want to do that. Some reasons to do a maximum trim: you extend the time between trimmings, less anesthesia because less times you have to do anesthesia, less money because you don't have to do it again. So some of those you can see in the positives: decrease axial strain, reduce pain quickly. So you're taking that pain off of the tooth when they're chewing immediately. Something negative though is you might stimulate the growth. Like if you trim the incisors, then you might get those incisors to activate, start going quickly. And I've had people come in like that before. They're like, I was just in here. Did you not do a good enough job? And we're like, I did the same job I did on all the others. Yeah, I don't know. For a maximum trim, if you open up that pulp cavity, which is the center of the tooth where the blood supply and the nerve endings are, you might get bacteria to enter, and then you created an abscess somewhere up in the tooth if you've gone too short. And then there's something hypertrophic gingival tissue. If you cut that tooth too short, and there's one, they own Peanut over here, and that was a concern on one of them, is like we got the tooth partially off, but in one of the first ones that broke in there, the gum closed over, and I was like, So what could happen is the gum closes over, and the next time you see that rabbit, there's a big lump there, there's a tooth up in there, but you can't get to it, and you have to cut the gum back, and then it means the second time you knock that rabbit out, it's super painful, you know, because you trimmed it too short or it broke off and further. One of the positives, though, is there is longer times between trims, because some of these rabbits were like, you know, it could work both ways. Like, we're like, I don't think we should do this again, you know, this rabbit, and the owners are like, please trim the teeth, just do it again, you know, and back and forth. For a moderate trim, meaning you're just bringing it down, sometimes if there's an abscess there up in the gum line and you've trimmed the teeth, you've brought blood supply to the area. It means a bigger abscess, and then it could rupture or has ruptured. Something else, you might have to do a moderate trim if the rabbit's really old. There is some cases where the teeth stop growing in the older rabbits, or the teeth get no stimulus, then the tooth may stop. And that's why sometimes you trim the teeth and then you don't see, like, that's it, that's all, you only had to trim it once, because the just stopped. And it could be like a 2-year-old rabbit, and there's no pressure, so there's no growth back there. A moderate trim is less painful for the rabbit too. There's something in dogs, they do a show cut on the nails, if you ever heard of that. Is like they will just usually have to do it under anesthesia. Sometimes no veterinarian will do it not under anesthesia, and no veterinarian that I know of will do it, but they'll just cut the nails. So it's like a dog that'll have really long nails, they'll just cut it right through the quick, and then the dog has to heal, but it's super painful. They called it show cut because they want that in the showroom for that type of thing. Essentially, like in some cases, that was what you could think of for a rabbit, but guinea pigs and chinchillas, that's what you're supposed to do, is trim them back as far as you can. This is a big thing. Any tooth can regrow even after you pull it. I'll show you an example of that coming up, but it's the germinal tissue that are down in there. What you do when you pull it is this is what the book says, you pull the tooth, You jam the tooth back in there and you twist it and try to scoop up that extra tissue, because that's where the rabbit's under, so he's not feeling this, but that's where the germinal tissue is. And when you pull that out, you'll see either a little cup and it's empty. Did you get it? Because it could be lining around the outside of the cup, or if the cup is full, is that the germinal tissue that was going to build the next tooth or keep the tooth growing? So this one, when someone says, can't you just pull it? Of course, we understand the frequent wish for owners is a long-term cure. And every extraction changes the anatomy and the forces. So sometimes you have those teeth, you pull one, things change, like you've changed it. So you may not have the same problem, but you could have a different problem that you created. But indications for extracting the cheek teeth are persistent infection, transverse fracture, meaning up the length of the tooth, then that tooth's got to go. If the tooth is loose, if there's severe growth disturbances of individual teeth, such as this one on the back side, you'll see one of these teeth had actually fractured down the bottom. And then if there's tilting of the teeth or any malformations. And then the growth of the antagonist tooth can stop after 3 to 4 months. But in that 3 to 4 months, it's 2 millimeters a week for 4 months of the opposite tooth to grow. So you have to take that into consideration. It may get better, but you have to be careful of that type of thing. This is this little rabbit came in, and I'd seen it like 2 years into its full mouth extraction on the other side. So this side was the one Dr. Helmler was up in Blue Pearl, and he extracted all the teeth there. I was seeing the rabbit because the opposite side, the side on top there, had started to do the same thing, and the owners decided we're not going to go through that again. So I had the skull preserved so I could see what was going on really, and it's either this or CT scan. You get to see, oh my gosh, look at that. That's what was going on. This is what happened all along, because imagine there's fur and muscle and tissue over this whole thing. But then we found on the side that had been pulled 2 years ago, that tiny little nubbin was a tooth growing back in there. So if the rabbit had continued living, that tooth might have ruptured in an area where there was no teeth before, on the upper and the lower. We'll see the other side of the skull here in a minute. This is a tough one, because this is usually what stops people from wanting to have the teeth ground down or looked at or anything, is the anesthesia, right? The only reason to go to surgery is to remove the cause if you're trying to actually do a fix. Treat with antibiotics. Usually, sometimes you have to treat for weeks. The thing you see that the patient must have a fighting spirit and be in a stable condition. Fighting spirit is like, I think you all, because you're rabbit people, you know what the difference is. We had this rabbit come in for a neuter. This was a couple of years ago. Male, just a neuter. He fairly young, like a year old. Put him out of the kennel into the cage, shut the door. He ran around 3 times, screamed, and died. And it was early in the morning. We hadn't even gotten to him yet. Like, out there, died. We were like, what was that? That was, beyond, had to call the owner. She had left. So turn right back around. He did nothing. Just, and then other times they'll come in hanging with a broken leg, and they're eating food, and they're happy, and they're doing their thing. So, like, fighting spirit represents a mental state of intense determination, courage, resilience to overcome adversity, characterized by a refusal to give up even in the face of extreme challenges. So you'll see that, you'll see that in your rabbits, that some will fight for it, some just lay over. And that's because they're prey animals. They often appear to die easily due to intense immediate shock or paralysis, including overwhelming stress, which causes their systems to shut down and conserve energy or to avoid injury. And is this submission the final survival mechanism, as motion of that animal would trigger whatever's attacking it to go harder and attack it further? So is it like the possum where it plays dead, or is it not to that extreme? Because really no one wants to eat a possum. You see them down all the time. They'll eat rabbits though. Prey species such as deer or rabbits have highly sensitive nervous systems, tense fear from being captured can cause cardiac arrest or extreme shock. So imagine adding bacterial sepsis, GI stasis, dehydration to this, and then the anesthesia is harder than what it would be on a different animal, including humans that you're knocking out. But in some cases, like the one I mentioned where the neuter, like everything was fine with him, we were assuming he was young, so that could be like cardiac or something related that's underlying from the start. So now we're going to abscesses. This part can get crazy, and I was mentioning before, I always like to say, look at where the abscess is coming from, and that helps you determine where the treatment is going. So look at the abscess. This next slide is the boring slide. So we'll get through it. It's okay. Inflammatory reaction with bacteria. So these bacteria are surrounded by a sugar coating. Certain bacteria have this extra sugar coating around the outside, and that makes them slippery, and it makes water like in a different way than other bacteria. So neutrophils are a white blood cell that fights off infection or inflammation. What they do that is they almost throw up this enzyme that is supposed to go through the sugar coating and destroy the bacteria that's there. So they are putting out this enzyme, and they will break down the bacteria in there. Hi, come on in.
Is this the bonding? No.
Is it a talk for dentistry?
Oh.
So the neutrophils have put out this enzyme. So what they do is break down the bacteria, but they also break down the red blood cells around there. They'll break down anything that's in there, and they form this fibrotic wall, and they're on the inside, and they're also dying off too. Sometimes this is within bone that's happening. So pus is forming in there too, and the pus is all that stuff broken down, but it also is really solid like pudding instead of liquidy. So you'll see like a cat that you abscess, or there's videos online where they show like a cow and you puncture it and then pus is just pouring out. That doesn't happen in a rabbit. That stuff is stuck up in there. You have to wash it, try to flush it out. But when it's in there like that, it also sucks water from around there. Thank you. It's good to see you.
It would be great, but I do want to hear about bonding.
Yeah, go.
Sorry.
Yeah, that's okay. The water is withdrawn from the surrounding tissue to keep the liquid in there too. So it's only a surgical procedure that you must remove that whole thing. That's what makes it hard, and if it's in bone like that previous one before. So tooth root abscess, first the overgrown roots go up into the area and the jawbone is damaged, and then the abscess starts, and then eventually it'll break through the skin like that. So where's the problem? Lower teeth issues. So think of just lower jaw. Teeth first perforate ventromedially on the floor and towards the center. You can't, and the inside like there, you can't feel that necessarily. And it's not detected until it's gotten so big that it'll rupture the ventrolateral side too. So first it actually comes in there, but unless the rabbit's letting you stroke in there, which is painful, so they're not going to, and then it'll start going out that way. Where's the abscess? So lower jaw, think lower incisors. If it's in here, this area, it's these two teeth right there that you got to take care of. Side jaw, then it's the premolars to M1. And then if it's the M2, M3, you're not going to detect it. Those are in the further back, and they're going to go drain in the larynx and the pharynx, and you won't. There's so much space back there that you're not going to see it. So if you're actually seeing it, you're either seeing it at lower incisors or the premolars to M1 there. But then that's where you got to take care of the problem. For upper teeth, maxilla, dorsolateral displacement to the lacrimal duct. This is what I was talking about, where they only have one puncta. That's the lacrimal duct. This is only P2, which is right there. If you notice, this is the orbit right there. No worries. There's a door back there too.
Can we go back there?
Yeah, I think you can get out there. Only P2 will mess with the eyes. P3, as you can see, is further back there, and it's in the orbit. An abscess at P3 to M3 is in the orbit of the eye, and there's a lot of tissue in there too, and you won't know that there's a problem until it's too late, because the eye's pooching out, and by that time there's so much pus in the back. M3, little guy, he's small, he'll fall out before he causes any problems. So P2, eye discharge. P3 to M2 It's a bulgy eye. It's late in the game. You'll see that this is where the eye is, and those little guys right here. Right here. That's, they're right in the orbit where that was. This is the upper jaw to that other lower jaw there. So that rabbit, it was a good call they did to end that rabbit. Yes.
Is it a good idea when you're, petting the rabbit to, kind of stroke his cheeks and stuff and see it, what is there like a pain response there if there's an abscess?
Always do that and pet other people's rabbits too, because then you're gonna see like, oh, your rabbit doesn't have a lump, but mine does have a lump, and then you'll start paying more attention to that and feeling that a little bit more. Mm-hmm.
Did you euthanize the rabbit for those intraocular?
That last one, that one there.
Yeah, was it euthanized?
Yeah.
I was wondering if you ever considered enucleating the eye and treating.
I'll talk to you about that too. Yeah. So some case studies here. This one, tongue spur, we see it a lot. You see that little bit right into the tongue right there. This one, lower molar cutting tooth, cutting into the tongue. Scar tissue will build up over there. So what you'll see is the rabbit's eating, and then it stops eating, and then it starts eating again, and then it stops eating again, because maybe you'll see some weight loss, some GI stasis, smaller stools. The callus builds over, and then the rabbit will cut through the callus, and then it's limping, or if it was a foot, but it's painful again, so it'll change in its eating. But then people see it, and they're like, oh, no, it got better. And then it got worse again a month later, or even 2 weeks later. They will change their eating habits. They'll eat greens and treats, but it may not want to eat hay because there's more work to do for hay. And when they stop eating hay, they make it worse because then they're not grinding things down. And then possibly in the end stages gives up pellets, and then you'll see weight loss. So pellets for weight, greens for all the extra nutrition, stimulus, but hay is for the teeth. If you think of that. There's some more cases. This big one was more recent, was the last one we did, where we saw the tongue had, and this rabbit actually came in fine. Like he was on his annual, but we had some stuff to discuss. This one over here, that one's like, is that going to be a problem? Because if you look at some of what naturally should be, they should have spikes there. They should have spikes that are more towards the tongue because they're chisels. Don't have chisels like that. But in this case, it's getting a little sharp. So we decided to put that one out. Track tongue. I think Dr. Anderson was involved with this one too. I think. So this one, both sides were causing problems. So you'll see the rabbit do weird tongue motions because they can't actually get their tongue out from where they need to, and they don't have full range of motion with everything there. And so that's what you'd see at home is things are like pieces of food, or things aren't being eaten all the way. The rabbit's using a lot of this and not grooming as much, that type of thing. Retrobulbar abscesses. This is what we were talking about. So third eye will be up. Eye discharge. Wiping there could be eating less stools, weight loss. P3, M3, under the eye, lots of space so you don't see it until the problem's there. But for bulgy eyes, you also have to watch because that could be heart disease and it could be a thymoma too. Nothing to do with dental. Things you have to watch for. And you'll see eye discharge, so sometimes you think it's the puncta closed, but that's P2, and you do a little push to the eye, again, for Mr. John there, see if it's uncomfortable. Like, push on the eye a little bit too. And what you're supposed to do when you have a racing heart is to put pressure on the eye. It slows your heart rate down, so it's not bad to do that. You're not jamming it in the eye with your thumb. You're just kind of doing a little massage, pushing the eye in. So this rabbit, the one that we were talking about, I think they recommended nucleation, which is removal of the eye to get to the teeth underneath. Yeah, it's usually where I see people stop with their treatment because the rabbit can see out of that eye. And then they wait it out, and then there's weight loss, and then they let the rabbit go when they need to, plus or minus pain medicine. It's a tough call. There's removal of the teeth inside the mouth is problematic. So the blue is the zygomatic arch there. You have to remove that too. Remove that, remove the eye, get to there. In horses, they do trephination where they just go in this way and knock the teeth down into the mouth and pull them out that way. I've said a lot, like horses and rabbits are so similar in their guts and their teeth position. There. Next case study, I'm going quick because she's giving me the 5-minute warning. This was a female spayed American with a long history of dental issues. You might recognize her, maybe. And then patients presents comfortable, no weight loss, I would say. Is this, what would you do in this case? Say you're the owner of this one. This tooth is tilted. So that's on the category of remove the teeth from that list before. The rabbit's comfortable. There's no weight loss there, I would say. So you have to think, or do you pull that tooth, you trim it, but if you imagine where the rest of the roots are going up into the head, then you think there's a problem up there. You could pull that tooth, and notice here there's only 3 teeth present, so we've already done some work on it. It's tough on this one too, because the teeth actually look good and it doesn't look like infection from where you can see it too. So then I'm going to go to the next one real quick. So a case study. This one happened like 8 years ago, and then you learn from stuff and you go further. My associate called me in real quick. There's these large vessels in the back there, back of the throat, and when you're trimming the teeth, you can see them right there. You just have to be very careful. But it was actually in the book was where I saw some ways to get around what was going on. She had lacerated the vessel back there. We lost the rabbit there, and that was like I forget if it was like a necessary teeth trim or like it was for maintenance. But you have to be very careful what's going on in the back of the throat. It's like one of the worst things I've ever seen.
I think that was Panda, Sarah Norris's rabbit.
Was it?
But that rabbit was like end stage dental. So it was more like a life-saving kind of last ditch. Yeah. I feel like they had one whole dental arcade removed even. Remember on one side?
That's the skull, but that's not the one we lacerated in the back. Yeah. Panda's the one that's the skull that's with the tooth that grown back in and everything. So, rabbit dental issues, why? Genetics, diet, environment. This is why it happens. That leads to change in those 3 will lead to why here, but I hope this presentation shows the predisposition that they're prone to that. Like certain teeth have a job, they're sacrificial, other teeth are there for a reason. The predisposition is there, but genetics, diet, environment, if one of those is off too, then it's more likely to have some problems. So you try to pick your favorite bunny, but then you get one that was in the rescue and an older gentleman owned it and fed it donuts and like donuts its whole life, and its teeth are the worst teeth I've ever seen. And it's only like a 2 or 3 year old rabbit.
Yeah, he actually died.
Oh no.
Yeah, Dr. Tillman, he stopped eating and the donut, both those donut bunny boys died, but
I got the guy died.
yeah, right.
The original guy, I think he died, that's why they had him in the rescue.
Exactly. But yeah, they both since passed. They were just she tried to trim the teeth and he just
That's probably a blessing for because his mouth was one of the worst I've ever seen.
The worst.
Yeah. So I was getting this together, this PowerPoint, and I was talking with Mr. Brassfield a lot about it, and in the middle of it, I was like, this is so depressing. This book is like, the outcome is the same. Like, and then you think, the outcome for all of us is the same, you know? But it's impossible to treat malocclusion or to cure malocclusion. You can slow it down, but you can't ever correct it because you pull one tooth and you have the other sliding around, so you have other things going on. Repeated trimming, slow changes, but don't halt them. It's always progressive. Earlier start of therapy, the better the long run for long-term prognosis. Dental treatment is only palliative. Advanced changes warrant humane euthanasia, which is like, in some cases, I'm always coming to that solution where we just have to let them go. Like, especially with the eye enucleation. We had another one. She went and did a CT scan, and they said, only way to do this is to remove the eye. And she said, the rabbit's happy. So I'm not going to put him through that. And I'm also not going to let him go just now, you know, which is total. So just think happy thoughts the whole time. Because you have these guys for 8 years, maybe 13 years, like maybe 5 years, but you're doing everything for them and they love you for it too. Earlier treatment start, best chance of good outcome. And then any teeth can regrow. Get x-rays, visit checkups, including visualization of the mouth and possible x-rays. Start your babies young. And then I think I'm out of time. A special thanks to Jennifer and Bradfield. Thank you. My husband, Dr. Bradley Frick, who's out somewhere with Eleanor.
I just wanted to mention something about the enucleation. I asked about it because we had that done with one of our bunnies. Maggie had like chronic weird personality for one thing, it was very strange. And then when she was about 8, she had unilateral bulging of the eye and huge abscess all interdigitated into the sinuses. And we opted to enucleate that side. And this was way before the dual-acting penicillin, which is the best thing ever since sliced bread, and now you can't get it.
Yeah.
But we did the dextrose packing, and it was changed twice a day. It was horrific. Even under anesthesia, she would.
This is after the eye came out?
After the enucleation. The abscess resolved.
Yeah.
She lived to be 15.
Okay.
Her personality totally changed. She went from being a Klingon who wanted to kill everybody to being the most loving. It makes me wonder if she had something going on there all of her life. And then this resolution gave her another lifespan.
Yeah.
So it's not always a bad thing to try, maybe, but I know people don't like to put their bunnies through something. But for us, for Maggie, it was worth it. One case.
What made you decide to go? Because she was young, she had life to her.
Yeah, she had that fighting spirit that you talked about. We figured she could handle it. She's named Maggie because she came in with the most horrific fly strike you've ever seen. And she never forgave us for that, for that name. But she was ferocious and nothing got her down. When she came home from having that maggots debrided, first thing that the vet was saying, we should euthanize her. We brought her in, and the first thing she did was leap for a banana. I was like, okay, we know where you want to be. So yeah, that's what you said.
I think that one panda, it had been a long road for that rabbit, and then we started seeing the other side doing the exact same thing. It was upper and lower, so it'd be like complete extractions on both upper and lower. Like sometimes that doesn't equal out the.
I just want to clarify. So for the retrovalvular abscess, you said you do have to remove the zygomatic arch when you take that. If it's dental?
It depends. If it's all three, I would say to get down to it. You can try to remove the eye, but then you have to break through the bottom of the orbit too. And depending on the size of the rabbit, the breed, how extensive this is, if you have one that's got like the bigger guys like English slops, that zygomatic arch is kind of in the way because then you have this pit that's down. You have to get the teeth out too, that are on the floor of the eye socket too. So sometimes you're in there burrowing. But the whole idea for the surgery, you remove the eye, you have to get the teeth out and remove the capsule of the abscess. And we're still working on someone doing a CT in our area. If you did a CT and saw like that whole thing is gone, then you're going to have to remove a lot of tissue just to get down in there. You could try, remove the eye, pack it, like you said. You can use the beads, the antibiotic beads, put them down in there, kind of seal it up, pack it with everything, sugar, all of that. And then you also have to think, so we're going to have to do another surgery to remove these things, clean it out again. You know, you try to plan for the future too. Yeah. Do you have a case now?
No, a friend of a friend. Yeah, there is a case I'm thinking of, and I was just wondering.
And they didn't remove the arch?
No.
Yeah. And they took the eye?
Yeah.
Yeah. Is it doing okay?
No.
Or no?
No, because it comes back. You can't get access to get in there to take the whole capsule.
Yeah, then it means but that's like the structure of all of this too, right. So and you're like, how far do we have to go?
Yeah, and it depends on the bunny. Like you said, some will fight through anything, or others you nick a nail and they think it's the end of the world. Like
Okay, any other questions? Anybody got any questions?
I do have a question. He's about an 8. How many? He's about between 5 and 8. He's, I adopted him. And just last year, my vet, I'm not from here, my vet had to he had infection coming out of his cheek. And I didn't know it because he has a lot of hair on his face, so I felt horrible. She found a huge abscess in there and she took out the tooth.
Yeah.
And I asked her, is it gonna come back? But it took that long. It was the first time there had ever been a problem. So am I likely to see a problem with that
Unfortunately,
again?
I'd have your vet always check that area
An X-ray maybe?
in the future, in an X-ray.
An X-ray
up to
every year,
that.
like once a year when I take them in for their exam?
Yeah.
Okay.
You could have nothing. Like you pull the tooth and if all the pus drains out the hole that
Yeah,
they created, then it'd be good. Some of the like off things that happen are they're swallowing that stuff. But if they're inhaling that stuff, then it goes to your lungs, and then you have an abscess in your lungs too. Sometimes you see these rabbits, and you're like, we don't know why, but we're euthanizing, because rabbits now not doing well, and we're like, we fixed the mouth, and then the rabbit still never recovers, and possibly the first place that something like that would go to would be the lungs, lymph nodes in the chest, and then abscess in the lungs, and they've had seen it in the organs too, but
Kind of strange that it happened as old as he is. First time ever.
Yeah,
had a
that's
problem.
good. That means hopefully good genetics.
Hope it's good. Okay, thank
Some
you.
weird things will happen, like they split a tooth or like chip a tooth, and then or a piece of something gets caught in there, or like they don't floss, and they can't. Even when we get them under, we're like, man, this is really hard between the spaces. But then we're pulling out hair and leave,
Kind of a
and
cool souvenir.
yeah. Yeah. Well, thank you all for coming. Yeah.
I'm not gonna let you off the hook yet. Many years ago, we were at an exotic EDM, remember then? If you don't remember, I'm really old, seminar, and Frances Harcourt Brown was talking about dental disease, and she said that in her practice over in the UK, where there's not very much sun, she saw a lot of dental disease in house rabbits rather than outdoor rabbits, and she was wondering whether there was a sunlight vitamin D component to this problem.
Definitely.
Do you tend to see like rabbits that don't get any sunlight? I mean, a window's probably enough, but if they're really not getting any, is it worse?
Yes. Well, like vitamin D, because that helps the whole calcium intake and everything. But then that whole thing about the lab rabbits aren't getting any sunlight either, unless they're having UV lights, which are more now.
I wonder if they're doing that.
Yeah,
because,
more
you
now.
have activity lights for your aquarium, maybe they're
Yeah.
doing that too.
Yeah, because once like some rabbit organizations get involved and like say you have to have so many feet per square inch of rabbit that you have, and they started regulating a bit more, they would also regulate the sunlight.
Right,
Too.
so it's like the whole metabolic
think
balance.
We don't see the ones that I've seen for metabolic bone disease. Like we've had some. There's one out in Arcadia, and he was a male intact breeder. He was like a tricolor, and I was thinking, you're a specialty type of genetics here, and he had like no calcium in his. We X-rayed him. There was no calcium anywhere, and we were thinking like, why are you so depleted in calcium in your entire body? Usually we don't see that in rabbits, even if like because they'll have kale and spinach and they'll get something, but the chain with vitamin D is very helpful. So I think he was kept in like a barn, inside the barn, in an area that he got no sunlight. Yeah, he was there because he also had cancer and an abscess that wouldn't fix. And then when we come in, we try to do our best for everything, but in our struggle of examining him, we broke his back. Yeah, and that's the first one we've ever broken it in my hospital. So then we x-rayed him, because at that point, then I don't have to worry if they're going to pay for it. I just want to wonder what the hell happened. Do I have to fire this technician because she was handling the rabbit too hard? Or we x-rayed him, I'm like, there's no calcium in this rabbit at all. But it was our fault that we broke the back, right? So it is, we did, but if I had known he had no calcium, like, we wouldn't have handled him at all. And he could have a little heart attack at any point, because no calcium means no calcium in the muscle, and then his heart's bad too. It was like,
That's weird.
Yeah.
I've never seen this. I know, like, for the sunlight, also to the immune system, I just see rabbits just don't do as well. They don't have access to sunlight.
Last little tiny, I'm like anybody else, big mouth in the room.
no, it's
I found it really interesting that the rabbit with the hay only diet lived so long. I wonder if there's been a lot of research recently in lab mice and rodents, and actually a little bit of stuff with humans, how super low calorie diets are associated with longevity.
Yeah.
I wonder if that has a component too, not just the teeth.
I think he got a lot of food.
That's so great.
Well, the hay has almost no calories.
He's one of mine, and I give the pyramid diet. So mine get grains, mine get pellets, and mine get hay. He just was a hay guy. He never really liked.
So we get lots of hay, but not only.
No, he had access to it.
He just didn't like it.
Yeah. Hay, he just loved his hay. He would eat hay all day long.
Thank you.
Yeah, all
He
day
wasn't thin, like low body condition score or
He was a
anything.
good, his body score was fine, his coat was good. He was a lion head Dutch mix. Yep, lion head Dutch. Didn't have blue eyes though, so maybe I'm not, but
Maybe the mixture helps.
Did you say you're working on getting a CT?
Not us personally, but somewhere in the area. That's the next step of what we need, something. And I think that'll really help Peanut if we wanted to see what exactly, and if it's at the stage where, which I think so, but.
Mine is the emergency.